self-defense corneotherapy clinic, our approach to skincare is similar to when a patient comes in with a medical condition. So when you're going to your physician's office, you tell him or her about your symptoms, and that doctor then gathers your history. So in the same way, when a patient comes in, I gather the history pertaining to the skin condition. I gather information about genetics, nutrition, lifestyle, medical history, and cosmetic history. Now, your physician then would start examining you. So in the same way, I do a visual examination of your face. But more than that, I also use a technology of skin fluorescence, and it is this machine behind me, which now reveals the layers of your skin that would not otherwise be visible by the naked eye. Now, your physician may then determine that you may need blood tests so that you have an objective level of how much sugar you have, or if you have kidney failure, how severe is it? So in the same way, we have blood tests for the skin. We have objective measurements, and we use a modern skin equipment from Germany to do this. And it checks 4 different parameters, which are the important parameters to check skin's health. So the first one is lipid, or sebum, or as laymen are more familiar with it, the oil. So how much oil is oil? Now, the second parameter that it measures is hydration. So how much water is inside the deeper layers of your skin. The third parameter is erythema, or redness. How much are you predisposed to redness or flushing? This parameter to me is important because it tells me or gives me an idea of how much connective tissue is in the skin. When you have very thin skin density, that collagen holds your blood vessels. And when you have very thin skin density, then the blood vessels start showing through the skin, and it can manifest as redness. Now, the fourth parameter is melanin density, or how dark your pigmentation is. And it also reveals your phototype. Now, that is very important too in today's world because of our mixed ethnicities. I remember seeing a lady who visually looked like a phototype 1. Now, phototype 1 are your Celtic skin, very fair skin. They may have red hair, most have freckles. So visually, she looked like a type 1. But when we measured her skin, she was actually a phototype 3. Now, your phototype 3 is a fair Asian skin. And she was about to go into a laser treatment. So imagine her surprise because she thought that with laser treatments, phototype 1 are really not high risk for that. But when you are phototype 3, you are moderate risk for burning or scarring or hyperpigmentation when you go for laser treatments. So now you have all these objective measurements that can serve as a starting point so that as you go through the treatments, we can keep on checking and measuring these levels so that you know that there is actually improvement instead of us just saying, oh, your skin looks good without any evidence to back it up. Now, as with any other regular visit, your doctor may end with a treatment plan for you. So at the end of your visit, I will sit down with you and I will discuss with you the skin conditions that may be appropriate for home treatment and which skin conditions that you have that are best treated by clinical intervention.